Welcome back to Tharani, I'm Joe B. Today we will go over manual therapy techniques that increased my patient's lumbar extension by 10 degrees, eventually resulting to reduced flat back posture. Let's dive in. A bilateral lumbar flexion dysfunction is when the superior and inferior facets are stuck downward and backward. This results to a decrease in lumbar lordosis, sacral extension, and posterior pelvic tilt. The cause of this can be due to weakness of the lumbar extensors, reduced body weight, and prolonged slouched or sacral sitting or standing posture. A bilateral lumbar flexion dysfunction can bring about central aching low back or tailbone pain without any tingling sensation or numbness down the legs. The assessment for a flexed lumbar vertebrae in this animation, we will assume that it is the L5 that is stuck in flexion. There are two types of tests that determine lumbar symmetry: the seated lumbar flexion test and the seated lumbar extension test. To make that vertebrae stick out, you need to select the seated lumbar extension test. Patient is in short sitting position, feet flat on the floor and arms across the shoulders. The therapist will be behind the patient. The iliac crest will be palpated first by the web space of therapist's hands. Then the dominant hand thumb will reach across to arrive at the L4 spinous process. From there, the thumb goes down to the next inferior spinous process, which will be L5. Afterwards, the thumbs move two finger breadths laterally to arrive at the transverse process, which will be the major landmark to palpate to determine the presence of a flexed vertebrae. The patient is then asked to arch for lumbar extension. When doing this assessment, always start by palpating the L5, then go superiorly until you arrive at the L1 to finish all the vertebrae. Normal findings are that all the lumbar vertebrae transverse process should move forwards or become less palpable. Abnormal findings to confirm the presence of L5 bilateral lumbar flexion is that both transverse processes will become more prominent during the seated lumbar extension, since the L5 facets are stuck down and backward. For the treatment, for instance, your L4 has the bilateral lumbar flexion dysfunction. The objective is for the L4 to improve its individual extension motion, and this can be attained through a non-thrust mobilization. The patient is in prone, arms at sides, and legs uncrossed. The therapist's dominant hand pisiform bone palpates the L4 spinous process, and the left hand reinforces. To provide a posterior-anterior vertebral force on L4, the therapist leans the body weight towards the hands and can oscillate from there for 30 oscillations for 3 reps and progress to holding it for 30 seconds for 3 reps. For the exercise, a quadruped to prone on elbows active range of motion exercise can be done for 10 reps, progressing to 30 seconds hold times for 3 reps. So do you want to know how to improve forward bending of the trunk, specifically lumbar flexion? If so, then this video is for you. Thank you so much.